Well, there's new hope for people living with a rare form of cancer known as ES. And joining us now to share more are Dr. Victor Villalobos, that is, and his patient Sandra Griego. Thank you so much for joining us.
It's a pleasure to be here.
Doctor, I want to start with you. Tell us what exactly ES is and who is at risk for getting it.
Sure. So ES stands for epithelioid sarcoma. And epithelial sarcomas are a subtype of cancer, a larger group of cancer called sarcoma. Sarcomas in general, about 1% of the population of cancers in general, so quite rare and also highly variable. So our approach to treating them can vary quite a bit as well, which really tells us that the importance of seeing these cancers in a sarcoma center that has expertise in this particular type of disease is extremely important. These tumors can be quite difficult to diagnose because they can arise pretty much from any location in the body. These arise from connective tissue, meaning it could be from bone, it could be from blood vessels, nerves, muscle, etc. And it can also affect any age group in the population. So this can happen in young kids to adults in their 80s, 90s.
And so what are some of the new treatment options that are available now?
So the treatments really depend on where the patient is and how they're presenting, whether they have localized disease or whether it's metastatic. Typically we utilize therapies such as surgery, radiation therapy, systemic therapies. And so systemic therapies encompass chemotherapies, targeted therapies. Importantly, recently there's been a new medication that has been conditionally approved by the FDA for the use of in sarcomas, particularly epithelial sarcoma. This can be used in patients ages 16 and above with a locally advanced disease or metastatic disease.
And Sandra,
the drug is called Tazverik. And this,
okay.
Good.
No, I'm sorry, go ahead. Tell us more about it. Tazverik?
Oh, so the drug is called Tazverik, and it uses a different mechanism of action compared to other drugs that are currently being utilized.
Okay, and Sandra, I wanted you to tell us a little bit about your struggle with ES and your backstory.
Well, my story began in May of 2015. I remember clearly I was at the gym. I was doing a warm-up on the exercise bike. I had my hands up on the bars, and my left arm just started to tingle, that feeling of pins and needles. And after several minutes, it just continued, so I called it a day and went home. As the days went by, my arm began to hurt more and more. I went to see my primary care physician. She sent me to do some physical therapy. My arm continued to get worse till where I've lost all function in my arm. Excuse me. I saw doctors and did many tests. Finally, I had a biopsy, and Dr. Villalobos had to tell me I had epithelioid sarcoma, which I said, what is this? And it was a very devastating time in my life.
And where are you with your treatment now, and how much does it mean to have these new treatment options available?
To have these new treatment options are wonderful, and that's why I'm here, hoping to bring awareness to epithelioid sarcoma.
Absolutely. Well, we appreciate you sharing your story with us. And Doctor, how can people get more information about ES and so that they can be in good health like Sandra is now?
Sure. So there's a couple of formats. You can actually look at looking at sarcomas in general. Sarcoma Coalition online. You can look there to find a local sarcoma center for treatments. And I cannot stress that importance there enough. And if you want more information on the new drug, Tazverik, you can go to tazverik.com.
All right. Sandra and Dr. Victor, thank you so much for being here. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.